This will be an environmental scan for the North Sydney Local Health District. We will be discussing plans and policies relevant to the local health district in both the internal and external environments, current and projected demographic profiles for the Northern Sydney population, the determinants of health, and the burden of disease in the population, along with morbidity and mortality data, and the findings of the environmental scan, including critical issues to be addressed. So environmental scans have been used by health researchers to address various health issues, including women's issues, health and housing, and mental health. These scans provide decision makers and population-based health with information about current social, economic, and political contexts. These scans aid in the design of health programs that are targeted to the needs of specific communities, which help to plan for the future. And they are a valuable tool in making decisions regarding a population's health and provides evidence for the production of health policy and program planning. So this environmental scan will be based on the local health district of Northern Sydney.
I'll be talking about plans and policies in the external environment. External environment comprised of all the outside factors which influence operation of any organization. In this case, external environment is the state of New South Wales and New South Wales Health Government. External environmental scan must identify the threats and opportunities that exist in the environment. Environmental scan is necessary due to the rapid changing environment and for the assessment of strength, weakness, opportunities, and threats in the existing plan. It also helps in improving measures and routinely assess the performance plan to safeguard the needs. Environmental variables include characteristics of healthcare delivery systems, external environment, and the community. For example, health policies and the availability of providers. These factors are examined because they are increasingly recognized as important, yet poorly understood influences on the utilization. The State Health Plan aims to assist New South Wales health delivery a system that is patient-oriented, dutiful, and empathetic, united and associated, providing the right care in the right place at the right time, based on confined settlement, characterized by a strong partnership, unconventional, financially viable, and it should cultivate an informative organization. All the environmental scans have some flaws and strongholds in different areas. These scans play a similar role with standard aims and consequences, although they are systematizingly distinct in each state. There are many external environmental problems which have been addressed. These are atmospheric conditions, depletion of biodiversity, modification of land and water resources. These environmental problems involve long-term amalgamation of economic, social, and environmental policies. The main concept of foundational policy statement on the rational growth is the combination of economic, social, and environmental inspection, such as Australia's National Strategy for Ecological Sustained Development. It was given by Australian government in 1992, and internationally there is Rio Declaration and Agenda 21, which was given by UN in 1992. Australia is a culturally, linguistically, and religiously diverse country. Multicultural countries provide a pivotal for gathering trust within the communities. There are some policies for the refugees, and it's immigration policies on the humanitarian ground. Two types of visas are granted for the Australian government under its humanitarian program. Refugee category visas for refugee under the convention relating to the state of refugee, and special humanitarian program visas for the person who are subjected to the substantial discrimination amounting the gross violation of the human rights in their home country.
So the Northern Sydney Local Health District can be classified as the internal environment when conducting an environmental scan. So the North Sydney Local Health District operates by complying with the National Health and Hospital Agreement, and decision-making in the Health District is led by the Health District Board and Local Health District Chief Executive. So the North Sydney Local Health District consists of public hospitals in Hornsby, Macquarie, Manly, Mona Vale, Royal North Shore and Ryde. And along with the care provided in these hospitals, the health district has services for primary and community health care, including aged care and rehabilitation services, chronic disease management, and programs and multicultural health. So there are various plans and policies that are implemented in this local health district for the betterment of the North Sydney community as a whole. Healthy Eating, Active Living is a plan for health promotion in the North Sydney community. Within this plan, there are various programs like Healthy Eating, Active Living initiative, which provides consistent support to schools in the local health district in order to develop a whole school approach towards healthy eating and participating in physical activity. The North Sydney Local Health District released a strategic plan for 2017 to 2022 to plan for the future delivery of health services by acknowledging the challenges to be faced and how they will be met, and building partnerships within the community, develop and deliver excellent health and wellbeing services. The strategic plan is based around 5 key principles to achieve the vision of leaders in healthcare, partners in wellbeing. The 5 key principles are healthy communities, connected person-centered care, evidence-based decision-making, responsive and adaptable organization, and engaged and empowered workforce. So with healthy communities, it focuses on prevention, early intervention, and community development strategies that will improve health outcomes. Connected person-centered care, so people have a good experience of care, which meets their health needs in partnership with multiple care providers. Evidence-based decision-making, so decisions are made on the basis of best available information and a philosophy of continuous improvement. Responsive and adaptable organization, so the structure and systems support the delivery of innovative and responsive services in partnership with other providers and our community. And engage and empowered workforce, so staff are confident, capable, and committed to the support and delivery of good care every day.
So the topic that I'm going to be talking about is the demographic profile of Northern Sydney. So in this, we'll be talking in detail about the characteristics of the population, the cultural diversity in the population growth rate, and we'll also be seeing about the employment status, the workforce profile, and the educational background of the people in the Northern Sydney region. So as per the 2016 Australian Bureau of Statistics report, the total population in Northern Sydney was estimated to be about 161,526 people, of which 48% were males and 51% were females. And the estimated resident population was about 72,037, which grew to 73,000 in 2017 and 74,000 in 2018. So from this, we can see that there is a growth in the population every year. And if you take the median age of the people in Northern Sydney, it's about 37 years of age, of which children comprised 17% of the population and the elderly age group comprised 14% of the population. Coming to the educational profile, we see that about 29% of the people were attending an educational institution, and of which we see that 25% were in primary schools and 27% in tertiary education. We also see that 14% of the people have reported that they have finished year 12, and 5.6% of them have finished a certificate 3 or 4, and 9.5% have completed an advanced diploma. As per the Australian Bureau of Statistics report, 90,000 people had reported to be in the workforce, of which almost 67% of the people had reported full time of work, and 25% of them have been involved in part-time work. About 4% of them have been away from work, and about 4.5% are unemployed. So this shows that majority of the people in North Sydney region have been employed, and it's just a minority that are unemployed. And to get in detail with the occupational categories, the most common occupation among the North Sydney region are about 42% of them are professionals and 20% of them are managers. So this shows that most of the occupation is definitely high collared, and compared to the other suburbs in the New South Wales Health District. When we talk about the country of birth, we see that about 55% of the people in North Sydney are Australians, and they do have other people from other cultural backgrounds, the Chinese, the British, the people from New Zealand, India, and Hong Kong. The income data shows that the average weekly income for a person in North Sydney is about $1,165 a week. And for a family, it is about $3,000. The household weekly expense is about $2,400. And we see that almost 40% of the families get a gross weekly income of $3,000, which is pretty high when compared to the other regions in Sydney. When we look into the SEIFA data, which is the socioeconomic indexes for areas, this data is normally an indicator to measure the disadvantage of one region in comparison with the other. And we see that North Sydney had a score of 1,108, which is comparatively high, indicating that North Sydney is one of the socio-economically well-developed regions. The indigenous population data suggests that about 0.3% of them reside in Northern Sydney, which is just a minority. And we see that 56% of them are males and 43 were females. And their average age is 27. And their average household income was about $2,379. And we see that this is more or less similar to the non-indigenous people, but relatively a bit lower. Now, we've been seeing the current demographic profile. When we look into the future population projection, we see that overall there is going to be a population growth to about 9.9 million in New South Wales by 2036. So currently we are having a population of about 7.5 million. And to be more precise, when we talk about Northern Sydney, there is a 13% population growth which is predicted for the year 2036. And about 29% growth when we look into the elderly age groups, that is above 70 years of age. There is going to be a 28 to a 29% increase in their population growth. So this is a clear indicator which shows that there is going to be a futuristic health demand in terms of health service delivery for the elderly.
So I'm going to talk about determinants of health for Northern Sydney Local Health District. So determinants of health can be described as features that shape an individual's present condition of health. These features can be genetic, socio-economic, psychosocial, behavioral, or communal in nature. The social determinants of health are the situations in which individuals are innate, cultivate, they work, live, and grow. It also includes the extensive set of services and organizations modeling the environments of day-to-day life cycle. These services and organizations comprise of trade and industry guidelines, improvement plans, community standards, public programs, and governmental schemes. Experts usually identify 5 factors determining health of a populace. The first one would be biology and heredities, which include gender and age as well. So North Sydney has a greater proportion of 25 to 34-year-olds, which is like 27.4%, which is quite parallel to the Sydney average as well. Here, male ratio is 47.2% and female ratio is 52.8%. The median age is 37 years and nearly 50% of people were born overseas, and majority of population is middle-aged working professionals. As per CIFA index as well, North Sydney scored 1108 points, which is quite less disadvantaged suburb across all over suburbs around Sydney. Now, the second one is individual etiquettes. So we can describe that by liquor usage, breastfeeding, food regime, dietary supplement use, the cleanliness, illicit drug use, immunization, oral health behaviors, pharmaceutical use. There's physical activity, then protective clothing use, then screening behaviors, seatbelt use, then there's sexual activity, which includes use of contraceptives as well, sun exposure protective behaviors, and the tobacco use. The third one is community setting. Nearly a third of North Sydney's inhabitants were born abroad, 18.2% from a non-English speaking background, compared with 24% for the Sydney average. North Sydney is a relatively affluent community with above average incomes as well. So here, overall 47.1% households and 1,700 per week, while 9.5% are low income households earning less than 500 per week. And overall 60.9% of the population hold tertiary qualifications, compared with 43% of the Sydney average. From 15,000 students attending schools and tertiary institutions in North Sydney, only 1 in 5 live in the local government area. Some of the determinants outlining community setting are exposure to crime, violence, and social disorder, such as the presence of trash as well. Then there's social support, social interactions as well. So here, the next one is physical atmosphere. Residence density is higher in North Sydney than in any other suburb of Sydney, with almost 25% living in intermediate density residences, which can be semi-detached, row, terrace, townhouses, and villa units, while 52.6% living in high density residences like flats and apartments. By 2031, North Sydney is obliged by state government to provide an additional 5,500 residences as outlined in the draft for North Sydney sub-regional strategy. North Sydney is home to some of the major commercial regions in Australia, as well as numerous minor commercial offices. In excess of 45,000 industries function from North Sydney. Few other examples of physical determinants of health are community involvement, civic engagement, bridging social capital to bring different communities together. Then there's culture, ethnicity, health cognition, language, religious belief or spirituality, safety and security, social class or caste. Then there's social support networks, including support and relationships. And the fifth one is health facilities. So here examples are accessibility to excellent health setting and taking or not taking health cover. North Sydney have 5 public hospitals in which 92% of the population receive treatment. The rest of the 8% are treated in private hospitals. Some determinants of health for health facility can be described as care-seeking patients, compliance with medical treatment, healthcare service use behaviors, pain behaviors, and responses to illness.
So the next section that I'm going to be talking about is the burden of disease. We see that intentional self-harm or suicidal behavior is high in Australia and in New South Wales pertaining to the younger age group. And in the Northern Sydney Health District, we see that about 1 person a day attempts suicide, and this is between the age groups of 15 to 19. Secondly, we see that cancer is the leading cause of death in Australia, and it's of significant priority as far as the Sydney Local Health District is concerned. And however, the proportion of cancer rates is lower in the North Sydney region when compared to the state average. Thirdly, alcohol presentations are also high in the North Sydney Local Health Districts. Deaths from heart disease are 50% higher in Australia's poorest areas. However, when we talk about the affluent regions such as the North Sydney areas, the level of heart disease is much lower. And among the various pockets in the North Sydney region, we see that Mosman amounts for a higher death rate due to cardiovascular disease among the other regions. When we talk about the life expectancy, we see that the life expectancy in the North Sydney region is the highest nationally for both males and females. And the residents of the North Sydney region are expected to have a life of about 85 years. And we also see that it is 2.7 years higher than the state average, which is only 83 years. And we see that the males in this region have a life expectancy of about 83 years, and which was 3.7 years higher than the males in the state. And the females had a life expectancy of 87 years, which was 2.3 years higher than for a state NSW female. And we all know that the life expectancy for the Aboriginal and the Torres Strait people is 10 years lower when compared to the non-Indigenous population, irrespective of the locality. Potentially preventable hospitalizations. We see that in terms of smoking, there were only 11.4 respondents in the North Shore and Ryde regions who had reported the usage of tobacco. And this is below the NSW average. But however, if proper health promotion strategies are put in place, such events could be prevented in future. And talking about the acute conditions, they comprise 55%, which is more than half of the potentially preventable hospitalizations, as per the statistics taken in the year 2013 and 14. And chronic conditions accounted for about 41% of the admissions in the Northern Sydney hospitals. Now, within the North Sydney region, we see that 40% of the population had one or more chronic conditions, of which cellulitis, kidney and urinary tract infections, and dental conditions make 40% of the potentially preventable hospitalizations. ENT infections, congestive heart failure, iron deficiency anemia, and chronic obstructive pulmonary disease accounted for 7% of the total potentially preventable hospitalizations. Overweight and obesity accounted for 39.2% of the respondents, and who had submitted a survey which was similar to the state population health survey in North Shore or Ryde, and they were found to be overweight and obese. So this, however, can be prevented by proper health education programs. And we also see that type 1 diabetes is higher in the North Sydney Health District. Hospitalization by category of cause or causes. The North Sydney region has a higher rate of alcohol attributable hospitalizations when compared to the state, and this is more significant in the areas of Manly, Mosman and Lane Cove. And the emergency department presents with patients who have a suicidal tendency and who have attempted to suicide. We also see that the patients who are in the who get admitted in the emergency are mostly in the age groups of 0, that is children at birth to 4 years of age, and elderly age groups above 80 years of age. And the rates of hospitalization for asthma and chronic obstructive pulmonary disease and other respiratory conditions are much lower in the Sydney Local Health District when compared to the state. We see that 12% of the people from this region have reported with long-term mental health conditions that require hospitalization. And about 5.3% of the residents aged 75 and over have dementia. The mortality rates in the North Sydney region are lower when compared to the state average. And in 2012 and 13, we see that about 437 people per 100,000 population showed there was the mortality rate when compared to the state average, which was about 545 per 100,000 population. And when we talk about the infant mortality, we see that it was 2.4 in the North Sydney region when compared to 3.5, which was in the Sydney, and 3.9 across the New South Wales district. Fall-related hospitalizations. The falls are a significant health issue for people aged over 65. And we see that the rate of hip fractures are marginally higher in the Northern Sydney region when compared to the state average. And the residents of the Northern Sydney aged 75 and above reported the emergency department due to falls, and this is about 12 in every 100. Potentially avoidable deaths. In 2011, 7.7 deaths per 100,000 population were attributed to diabetes. And a further 24.7 deaths were associated with diabetes. And this is considerably lower when compared to the state average. And similar to the NSW, the mortality rate from cardiovascular disease has declined significantly in the North Sydney health region, with both males and female deaths falling by approximately 40% between 2012 and 2013.
I'm going to talk about relevant morbidity and mortality data of Northern Sydney Primary Health District. Morbidity refers to illness or chronic conditions. A person may have more than one chronic condition at the same time. To determine the level of morbidity, prevalence is used very often as a measure in a population. According to Australian Institute of Health and Welfare, cardiovascular disease, cancers, respiratory disease, kidney disease, and diabetes are the most common forms of chronic disease in Australia. According to Sydney North Health Network, approximately 6.2% of the North Sydney population has affected by 5 or more chronic conditions, compared with 8.8% of the NSW population. Complex multimorbidity is the condition where 3 or more parts of the body are affected. 9.4% population of North Sydney population has complex multimorbidity, compared with 12.2% in NSW. Mortality refers to the number of death of people in a time in a certain number of population. It is used to differentiate a number of people and also indicate the differences in their health status. Generally, the mortality rate in Sydney North Primary Health Network is lower than all primary health networks in NSW. In 2012 and 2013, the Sydney North Health Network region had a mortality rate of 437 per 100,000 population, whereas the mortality rate for NSW at that time was 545 per 100,000 population. There are some dissimilarities in the mortality rate between local government areas in this area. All the local government areas are below 500 per 100,000 except Hunters Hill because of their small population and small number of deaths. Infant mortality rate is an age-specific measure to understand the level and causes of infant deaths. The average annual infant death between 2008 and 2012 was 2.4 in the North Sydney region, compared to 3.5 in Sydney and 3.9 across NSW. Despite of different variations in the catchment between local government areas within the North Sydney region, the number of infant deaths in that time frame is fairly low, which makes the comparison less significant. Death of people below 75 years of age that could have been obviated if successful health promotion or health in treatments could take place, or services such as primary care or in the hospital could be accessed by the people beforehand, is often denoted as premature mortality. In comparison to 240 per 100,000 for NSW and 216 per 100,000 for Sydney, North Sydney region had a premature mortality rate of 161 per 100,000 for the years of 2008 to 2012.
So I'm discussing health issues that need to be addressed. North Sydney Local Health District is among one of the 15 districts of New South Wales. The total area covered under the district provision is 900 square kilometres. In context of healthcare, there are two portable services. One is regarding justice health and forensic mental health, and other is regarding Children's Hospital in Sydney. There is also a tertiary network in healthcare that is operated by St. Vincent's Health. Role of NSLHD, that is North Sydney Local Health District. The principal role of this health district is facilitating effective and efficient healthcare service in different aspects like acquiring, maintaining of patient care center, investing and planning on present and future health needs, establishing proper balance and use of resources and implementation of strategic planning. To cope up with every single issue, the New South Wales government formed Clinical Service Plan. Clinical Service Plan involves all type of services, that is, services regarding mental health in and outpatient services, ambulance services, and services related to drug and alcohol abuse. It basically involves strategic planning for providing public better healthcare facilities by reviewing the clinical service plan every year and replacing it with better strategy. At present, North Sydney Local Health District is also covered under the clinical service plan, which has well-planned healthcare strategies for a period of 2017 to 2022. The previous clinical service plan addressed a number of North Sydney Local Health District services like work plan, disability plan, Aboriginal health plan, multicultural health plan. In order to implement new policies, they conduct an environmental scan regarding implication of certain policies. The main motive of NSW 2021, a plan to make NSW number 1 and NSW State Health Plan towards 2021, which was released in 2014, relied on three basic principles of keeping people healthy, ensuring efficient clinical services, and providing integrated care to the public. Under this strategic planning, NSLHD strategized to focus on promoting healthy living, control of alcohol and tobacco consumption, etc. They also aim to provide effective clinical care for the stroke patients and provide integrated services for older people. The major health issues marked that needs to be addressed in the North Sydney local health districts include promotion of health or providing quality care for the older people or people suffering from mental health conditions, health issues related to multicultural group of people, chronic disease like cancers, cardiovascular diseases, and respiratory diseases. The demographic profile and health status. In 2011, reading of NSLHD indicates that there were about 8,053,162 estimated residents in the district, among which 11.8% population of NSW. Further, the population recorded in 2015 were estimated to be 8,096,075. However, NSLHD has a very low population, that is 0.3% belonging to the Aboriginals and Torres Strait Islander group. Also, people with disability living in long-term accommodation were 3.4%, while the people with a severe disability were 2.5%. This is the table for current and estimated population profile. After viewing the past and present scenario, an estimated population between 2015 and 2025 was expected to grow by 13.2%. Studies has also marked that population aged between 0 to 69 years would increase by 11.3%, while individuals aged between 70 to 84 years would increase by 35.8%, and people above 84 years would be increased by 21.9%. That's the graph for the population change by age from 2015 to 2025. So focusing on health-related behaviors of the people in North Sydney Local Health District, the burden of chronic disease is quite lower in comparison to total New South Wales. Mortality is another factor to be studied. Deaths per year in different areas of the New South Wales North Sydney Local Health District figure shows that standardized mortality ratio in this region due to chronic disease or accidents. That's the chart. This is the deaths by all causes, deaths by cancer, deaths by accidents, cardiovascular diseases, heart diseases, and respiratory diseases. These are the major parts of the North Sydney Health District, and that's the New South Wales. If we take it as the main whole population, and that is the percentage. So healthcare services significantly include aged care services, which is one of the major community service approaches. However, decreasing the package or cost of healthcare service has shown the decline in service facilities and quality care. This is the aged care places by health service recorded in 2014. That's the home care places, residential care places, that's transition care places, that's the total number of places. North Sydney Local Health District has focused on the sustainable development in the district. The deteriorating environmental factor has also a negative impact on the health of the people. Sustainability plan for the Sydney Local Health District has come up with the issue of climatic change that is to be taken in immediate action. Thus, for reviewing this issue, various policies and legislative actions are being taken into consideration to improve the situation. Thus, by summarizing environmental scan and all healthcare issues in North Sydney Local Health District, it can be concluded that improvement in aged care facilities is the most urgent requirement for North Sydney Local Health District, as the maximum population will be between 70 to 84 years by the end of 2025. Planning for the future while considering the events of the past and present would aid in delivering better services in the future. That's a list of capital projects between 2012 to 22 by the government in different parts of North Sydney Local Health District. These are the references. Thank you.